Thank you, Mr. Chairman, and thank you, Dr. Monahan. Nice to see you again. I appreciated our discussion the other day. I hope that calmed your fears about what this interrogation and meeting was going to be about. We're not here to scare anybody. I do think it's important that we ask hard questions. The status and the trust in the American medical system has been decimated, absolutely decimated, because of the partisanship that we saw during the pandemic. It's terrible, and sadly enough, I'm just going to say the perception was that either by coercion or participation, there was thought to be some partisanship seen in the House Physician's Office by some of these actions. I'm just going to drill down a little bit on this plexiglass thing because I was absolutely blown away by it. Do you think that was appropriate to bring someone in on an airplane? At that time, we didn't know anything about transmissibility, whether if you were COVID positive, COVID negative, whether you were infectious, not infectious, or what. Do you, as a physician talking to another physician, think that that was an appropriate action?
For people in quarantine, they should not travel on airplanes and commercial transport. I wouldn't.
So the answer is no.
Could you repeat the question again, sir?
Do you think the actions taken by the speaker at that point in time to have someone who had just had COVID, whether they tested positive or not, I have a little bit of question as to whether that was, do you think it was appropriate, given your medical opinion and the standard of care, that that person transported, came on an airplane, went through an airport, came through the House chamber, and went up into that plexiglass room? Do you think that was an appropriate action?
Theoretically, sir, I would say no. I was not aware of that scenario that you described occurring.
Yeah, I would say no, in my medical opinion, and I'd do that in a court of law. I thought it was absolutely inappropriate. And this, again, shows to the partisanship that we saw bending the rules in COVID that was seen in so many different areas. You said you relied on the CDC a lot. Did you ever speak personally with Dr. Fauci about any of this?
I talked to him perhaps 3 times over the 3 years, sir.
And his recommendations at certain points were what? Do you recall?
Or mostly just to reinforce the existing CDC guidelines. He didn't share with me any insight more than was in the guidelines.
Okay. He is a quite polarizing figure, and I think personally, and I'll say this from a physician's standpoint, done more to undermine distrust in our medical system than any other person in medical history, but that's a different aside. In your office, can you tell us a little bit about how you are able to access specialty care for individuals, patients who need it?
Members of Congress have multiple options. Here in the Washington, D.C. region, we have a large number of specialists, university medical centers, military medical centers, civilian practices. I try to find the best possible consultant available for the member based on my understanding of this community and what the member's needs are. Members can avail themselves through their health insurance fee-for-service deductibles with any specialists in this area that I arrange. They also have the option to seek medical care at one of our local military medical centers without charge.
All right, well, thank you. I don't want to beat a dead horse because I think a lot of the questions previously, it's obvious that the House Physician's Office is deeply appreciated, hopefully never needed as far as in a time emergency. I was quite, I don't want to say alarmed, but just surprised that you guys have such a large carriage area for anything that would happen in a large area. Do you have folks that are trauma trained?
Yes, sir. I have an emergency medicine physician who's trained for all types of trauma responses. I have emergency medicine technicians who are trained in trauma response, patient transport, et cetera.
And they're here just when the House is in session or the Senate's in session?
No, sir. They're here throughout business hours and when the House and Senate is in session.
Okay. And I'll ask one last question. This is somewhat of a personal one. I'm a board certified, still practicing urologist. I had a conversation with you a couple months ago about being able to maybe just use a room because I had a congressional colleague ask me for an expert opinion about something. You were reluctant to allow that at that point in time. I hope we can get individually to a point where the answer would be yes. We have 19 medical professionals in this building, and sometimes expertise, since you don't have specialty care, and it would be referred out, would be of interest and in the best interest of members of Congress. So I hope you and I offline can come to some type of agreement where that expertise could be given to our fellow members.
Yeah, I'd like to get to yes, sir.
All right. Thank you, Mr. Chairman. I have no other questions.